Welcome to the opening chapter of our exploration into patient safety. We'll begin by examining a phenomenon found in the literature and addressed by national patient safety organizations known as failure to rescue. Failure to rescue is defined as the death of a patient following an occurrence of an adverse event during hospitalization. The failure to prevent a patient's death resulting from complications of an acute illness, surgery, or as a result of medical care is a healthcare crisis. Today, nurses must have foundational knowledge and a skill set to function effectively in the extremely complex environment of the acute care setting. Many patients have multiple chronic diseases and comorbidities, creating unique challenges for healthcare professionals to manage. As you probably have already experienced, patients can vary in their responses to medications, treatments, and interventions intended to help improve the patient's clinical status. Close observations of patients is essential to keep them safe. The National Patient Safety Agency in 2018 reported that 26% of preventable patient deaths could be attributable to failures in clinical monitoring. This alarming data provides a clear focus and strategy for nurses to prevent patient harm. Early observation and focused assessment skills are essential for recognition of the physiological patient cues before harm occurs. Over the last decade, evidence from retrospective medical chart reviews demonstrates evidence of observable physiological signs of deterioration occurred in most patients from 6 to 24 hours prior to cardiac arrest. A very small percentage of cardiac arrests occurred without any preceding observable physiological evidence. It's likely they were caused by sudden cardiac death. The ability to recognize these early and subtle changes in a patient's clinical condition indicating serious deterioration is crucial for the nurse to understand and incorporate into their daily nursing practice. Research indicates approximately 80% of in-hospital cardiac arrests are preventable. Regrettably, only about 20% of those patients survive to discharge. This course is designed to help you recognize the early signs of clinical instability and take early action to prevent cardiac arrest from occurring. Failure to rescue is comprised of three main systemic issues that contribute to unrecognized and untreated patient deterioration: failure to recognize, failure to act, and failure to communicate. We will discuss each of these components in more detail to help you become familiar with the concepts and understand how to incorporate this knowledge into your nursing practice. Let's discuss in a case study. Mrs. Smith had surgery to remove her gallbladder. The surgery was performed without any complications. In the recovery room while being monitored, she was given medication for pain and was transferred to the medical surgical floor. The patient continued to complain of abdominal pain, an expected finding after this type of surgery. The nurse checked and charted Mrs. Smith's blood pressure as 92/56 and a heart rate of 112. The nurse gave the patient the prescribed pain medication, but did not reassess the patient's abdomen or surgical site. Several hours later, the patient's vital signs were taken again. This time, the nurse noted the patient was a little confused. The nurse assumed the confusion was caused by the pain medication. The patient's vital signs now reflected a blood pressure of 82/48 and a heart rate of 120 beats per minute. The nurse recorded this data in the patient's chart, but did not take any further action or communicate any concern. A short time later, a different nurse passing by the patient's room found Mrs. Smith in acute distress and called for help. Unfortunately, the patient quickly became unresponsive and suffered a cardiac arrest. The hospital's Code Blue team could not resuscitate her. She was pronounced dead after unsuccessful efforts to save her life. She had been bleeding internally, but the nurse completely missed the cues of patient deterioration until it was too late. Hypotension and tachycardia are not even the earliest indicators of patient deterioration, as we'll learn in the upcoming chapters.